They've been on fire, around $70 a share. Now it's in the 200s. What you're doing is kind of taking the platform and the linear, you're putting them together. A much stickier solution. Livongo and Teladoc are merging. Teladoc is the virtual remote telemedicine platform. They've been on fire. They've like tripled in their stock price in the past few months. I think it was around $70 a share. Now it's in the 200s. Doing phenomenally well. And now Livongo and them are merging. And this, I guess, just came together in the past few months. Livongo specializes in remote coaching for diabetes, among other chronic conditions. When I think about a Livongo, they are doing this all with their own staff. I don't think there's a platform dynamic with Livongo. So to me, kind of what I was talking about before, where you have many platform businesses that, the platform IPOs, and then you try to put linear revenue streams on top of that. That's actually what this is to me. It's a digital linear business, Livongo. They're providing coaching. And I think my understanding is they're providing a lot of tools and services to at-risk patients. And so they'll work with an insurance company. The insurance company will say, hey, I want you to give your solution to this at-risk population. And if you can bring down or improve their health, it's worth whatever money I'm paying to Livongo, or they can have like cost sharing revenue, kind of cost sharing plans to generate revenue. It's kind of like a linear, digitally enabled, this remote coach for these at-risk patients with these different chronic conditions. And so now, where Teladoc has the platform model, Livongo has that linear model. There might be parts of it that are platform, but what you're doing is kind of taking the platform and the linear, you're putting them together. Teladoc is going to be able to better monetize and now have a bundled service offering where they have, the platform marketplace for remote telemedicine and these kinds of things. And then they have a much more kind of like premium, this linear offering from Livongo, which they can now deliver much more kind of targeted results for these patients and these at-risk patients with chronic conditions. I think this would be really interesting. I like it, actually. Again, you're kind of taking that platform and the linear, you're putting it together. It's going to allow Teladoc or the merged entity to have a much stickier solution with, with the healthcare companies, with the providers, and all the players really involved in that healthcare supply chain. So I think that'll be pretty interesting for them. Hi, this is Alex from Winner Take All. Thanks for joining us. Hope you enjoyed the content. Feel free to leave a comment, ask us questions, and definitely make sure to join us on our next live stream.